Just now there was biochem lecture, right? Okay, we'll wait for 1 or 2 minutes, then we'll inshallah start. Okay, we'll start. Okay, all of you can hear me? Yes? Yes?
Yes,
can you hear
Dr.
me? Okay,
yes.
So we'll start. Okay, so we'll start the lecture now. This is a very important lecture, neoplasia. Okay, neoplasia. We will see today the definition, what is the neoplasia and what's the classification. What do you mean by neoplasia? Any of you know what is neoplasia? What is neoplasia? No idea? Okay, so what is neoplasia? I will start. Okay, so neoplasia, it is just like, it is in normal terms we call it cancer. Cancer. So today we are going to see in normal language we tell cancer. Okay, so in medical term it is called as a neoplasia. Okay, so cancer in the medical language it is called as a neoplasia. So what is neoplasia? It is a new growth. Okay, it is a new growth, but what is the peculiarity? What is the peculiarity of this growth? It is uncontrolled growth. It cannot be controlled by growth. It has no control. Because even in our body, there is some cells which are dividing. Just like skin cells or GIT cells. But there is a control. They divide and they stop. Okay, but here the cells are continuously dividing. There is no control. Okay, and that is called as cancer, or that is called as a neoplasia. So this is a growth which is uncontrolled. It is not controlled by the growth controls. Okay, so it is a progressive, purposeless, pathological proliferation of the cells. Okay, it is purposeless. No purpose is there. The cells are just dividing, and they are forming a mass. So that is called as a cancer or neoplasia. Okay, so what is a neoplasm? When the cells are growing, it will produce a mass. Okay, that mass is called as neoplasm. Okay, that mass is called as a neoplasm. Then finally, the mass will produce a swelling. Okay, on the swelling on the body, the mass will produce a swelling on the body, like so that swelling is called as a tumor. Okay, so all of you understood what is the definition of neoplasia? Neoplasia is the growth of cells which is uncontrollable. It is not controlled. The cells keep on dividing. There is no control, and they will form a mass which is called as the neoplasm, and they will form a swelling which is called as a tumor. So in medical language, the study of tumor, there is a special branch, and there is a special doctors which study the tumors and neoplasm, and that branch is called as the oncology. Okay, if you will go in hospital, you will realize there is a branch which is called as the oncology, and that is the study of tumors or neoplasms. Okay, and this is the cancer which is commonly used for terms for malignant tumors. Okay, there are two types of tumors, benign and malignant. So for malignant, we will see this one, but for malignant tumors, we use the term cancer. And cancer is caused by some agents which are called as carcinogens. We will see this in the lecture on day after tomorrow, carcinogenesis. So those are chemical, physical, genetic, and all these factors, they cause cancer, and they will cause DNA damage, and the neoplasm will develop, the cancer will develop. Okay, so this is the definition of cancer or neoplasia. So there are two types of tumors, benign and malignant. Okay, so what is the definition of benign and malignant? The benign tumors are less dangerous. Okay, they are very small in size, they do not grow fast, and they grow slowly, and they do not spread to the other parts of the body. So these are benign tumors, less dangerous. And what the benign tumors, in the name, in the end, there is this suffix, OMA. In all the benign tumors, there is the suffix OMA. So that is fibroma, osteoma, adenoma, papilloma, chordoma. So these are all benign tumors. Whenever at the end there is OMA, this is the benign tumor. Okay. When it is a malignant tumor are more dangerous. They grow very fast, they spread very fast to the other organs, and they are very invasive. They are very dangerous. So these malignant tumors, they always end with carcinoma or sarcoma. Okay, so you can see this fibrosarcoma, osteosarcoma, adenocarcinoma, squamous cell carcinoma, chondrosarcoma. So when the tumor names end with carcinoma and sarcoma, it is a malignant tumor. Okay, and when the tumor name ends with OMA, it is a benign tumor. Okay, exceptions are of malignant tumor, leukemia. What is leukemia? Can anyone tell me what is leukemia? Yes?
Cancer of blood.
Yes, it is a cancer of the blood. Okay, so you can see cancer of the blood cells, but here in the end there is not. It is a malignant tumor, but at the end there is no sarcoma or carcinoma. Okay, at the end there is no. 1 minute. Okay, there is at the end there is no sarcoma or carcinoma, but it is leukemia, lymphoma, and glioma. So here you can see there is no sarcoma, carcinoma, but these are malignant tumors. So these are the. This is how we name the tumors. Okay, now we will see nomenclature. Okay, how we name the tumors. Okay, how we name the tumors. Which are tumors? Suppose the tumor is arising from the glands. Okay, from the glands. If the tumor is arising, if the tumor is arising from the glands, it is called as the adenoma. Okay, if the tumor is arising and forming a papillary finger-like projection, you can see finger-like projection. It is called as a papilloma. When the tumor is arising like a mass above the mucosal surface, it is producing a mass above the mucosal surface. It is called as a polyp. And when the tumor is hollow inside, it is hollow inside. It has some fluid. It is called as the cyst adenomas. So you have to understand that you can see this picture, then you will understand better. You can see this is adenoma. Lot of glands are proliferating. You can see these are glands. These round circular these are glands. Okay, so when there is a tumor arising from the glands, lot of glands are proliferating. Lot of glands are multiplying. They are called as adenomas. Okay, when the neoplasia is developing, when the cancer is developing and producing finger-like projection, you can see it is producing a finger-like projection, like tall, thin processes, which is finger-like projection. So this is called as a papilloma. Okay, then when the tumor is producing a mass above the surface, you can see this mass. This is the intestine which we have cut open. So in the intestine, these mass are projecting above the intestinal epithelium. You can see the round masses. Okay, so these round masses they are called as the polyps. So you should understand there is adenoma, papilloma, and polyp. Adenoma is the tumor of the glands, papilloma finger-like projections, and polyps are the small round projections mass which is above the surface. So this is how we name the tumors. Okay. Then classification of the tumors. Okay. What is how we classify the tumors according to the histogenesis. Histogenesis means what do you mean by histology? From the cell they originate. Okay, from which cell they are originating? That is called as a histogenesis. So from which cell they are originating, we will classify according to them. Then according to the behavior, whether it is benign or malignant. Benign, I told you, they are less dangerous, they will not grow fast, and they will grow very slowly, and they will not spread. And whereas the malignant tumors, they are very large in size, they grow very fast, and they spread to the other organs. So malignant and benign. Then organ of origin, from which organ it is developing, like lung. If the tumor is in the lung, we will call it lung carcinoma, lung tumor. If it is arising from the intestine, it is called the intestinal tumor. Okay, if it is arising from the liver, we will say liver cancer. So according to the organ of origin. Then according to the naked eye appearance, I told you, if it is looking like a polyp, we will see a polyp. Okay, so this is the naked eye appearance. Then degree of differentiation. What do you mean by degree of differentiation? If we see the histology, if we see the histology and the cell is resembling the original tissue, these are the glands and they are resembling the original glands only. Okay, so it is called the well differentiated. Means it resembles the original tissue. So it is called the well differentiated. But if it doesn't resemble the original cells, it will look something different from the original cells, then it is called as the poorly differentiated. So benign tumors are usually well differentiated. They will resemble the original cell from where it is originating. But malignant tumors, they are poorly differentiated. The cell will not resemble the original tissue. Okay, then etiological. What do you mean by etiological? According to the cause. What is the cause of the tumor? So that is called the etiological. And functional. Functional means whether they are secreting, whether they are obstructing, or whether they are secreting any hormones. So these are called as the functional. So this is the classification of the tumors. So now according to the tissue of origin means from which tissue they are originating. So I told you the benign tumors will end with OMA and the malignant tumors will end with sarcoma or carcinoma. So if the tumor is arising from fibrous tissue, it is called as fibroma. Understanding? If the tumor is arising from fibrous tissue, it is called as a fibroma. If the tumor is arising from adipose tissue, it is called as the lipoma. Similarly, if it is a malignant tumor, it is called as a fibrosarcoma, liposarcoma, like this. If it is arising from the cartilage, it is benign tumor, it is called as a chondroma, malignant chondroma. sarcoma. Bone, if it is a benign tumor arising from the bone, osteoma, and malignant tumor, osteogenic sarcoma or osteosarcoma. So this is how we differentiate between benign and malignant. Benign will ending will have OMA, and malignant will have ending sarcoma or carcinoma. So here also blood vessels, only from the blood vessel, if they are originating, the tumor is called as hemangioma. Okay. If the tumor is originating from the blood vessel, it is called as hemangioma. Okay. And if it is arising from it is malignant tumor, angiosarcoma. Similarly, the lymphatic vessels. If it is arising from the lymphatic vessel, it is, the benign tumor is called the lymphangioma, and the malignant lymphangiosarcoma. So always remember, if the tumor is benign, it will end with OMA. If it is a malignant, it will end with sarcoma or carcinoma. Okay. Like here also, smooth muscle, they are called the leoma. Okay, and it is called the leiomyoma. So this is the same thing which you have to understand. So this is how we name the tumor. So you should remember, if it ends with OA, it is called as OMA, it is benign tumor, and it is malignant is sarcoma or carcinoma. So smooth muscle, if it is arising, it is called the leiomyoma, and the benign is a leiomyosarcoma. If it is arising from the striated muscle, the skeletal muscle, it will call the rhabdomyoma. If it is a malignant tumor, it is called the rhabdomyosarcoma. So this is how we name the tumor. So now see, this is the bone. You know which bone is this? This is the femur, leg bone. Okay, this is the leg bone in the leg, the thigh bone. So this is the femur, and see, you can see a large mass is arising. A large mass is arising from the bone. So this is a malignant tumor because the mass is very large and it is growing very fast. So this is a malignant tumor. Benign tumors are small in size. Okay, so you can see this is a large mass which is growing, and it is growing so much that it is coming outside the bone. So this large mass which is arising from the cortex of the bone and it is extending outward, it is spreading outward. It is a malignant tumor of the bone, and it is called the osteosarcoma. Because it is sarcoma, it is a malignant tumor, osteosarcoma. Now here you can see this is the tumor of the smooth muscle, leiomyoma. So it is which tumor it is, benign or malignant? Can you tell me? Yes, it is benign or malignant?
Benign.
See, yes, it is benign because it is ending with OMA. Osteosarcoma is malignant because it is ending with sarcoma. So you can see this is a benign because it is ending with OMA. So fibromyalgia, leiomyoma, it is a benign tumor of the smooth muscle. So it will be small in size. So you can see these small masses. These small masses, they are small masses which are arising from the uterus. This is the uterus. Okay, from the uterus, from the myometrium, from the muscle layer of the uterus, small masses are arising, and they are called as from the smooth muscle. They are arising from the smooth muscle. They are benign tumor, and they are called as the leiomyoma or fibromyalgia. So multiple well-round lesions, tumors, they are arising from this thing. So this is called as fibroma or leiomyoma. Then according to the tumor of origin, according to the origin of the cells. Okay, now we will see what is the origin of the cells. If they are, now there are various cells in our body, you know, squamous epithelium, basal cells, epithelial lining, glands, you know. So there are many layers of the many cells in our body. So if they are arising from the stratified squamous epithelium, so if it is a benign tumor, it is called the squamous cell papilloma. If it is a malignant tumor, it is called the squamous cell carcinoma. Similarly, from the basal cell of the skin, so it will be the basal cell carcinoma. So if they are arising from the glands, and you know these glands are present in all the respiratory tract, the renal cell, liver cell. So if they are arising from the glands, so they are called as adenoma. You can see they are called as adenoma. And if it is a malignant tumor, it will be called as adenocarcinoma. So this is how we name according to the cell of from which cells they are originating. Now see, this is the squamous cell carcinoma. You can see this is the skin. Skin has squamous cell layer. You can see this is the squamous cell layer. Many layers of cells are there. If the tumor is arising from this layer, squamous cell, so what will happen? The tumor will grow inside, and it will the squamous cells are proliferating. They are multiplying, and you can see they are multiplying and they are going down. They usually do not go down, but they are multiplying and they are going down, and they are forming round lesions. And this in the center you have the keratin material. This is called the keratin pearls. So this is the squamous cell carcinoma and it is a malignant tumor because it is ending with carcinoma. So it is a malignant tumor, and see the squamous cell is proliferating and it is going down, and the squamous cells are growing inside and they are proliferating. They are multiplying too much and they are forming round bodies with central keratin pearls, keratin material. So this is a squamous cell carcinoma. Now see in the cell in our body in the skin there is also basal cells. So the tumor arising from the basal cell, it is called the basal cell carcinoma. You can see this is the face, and this is the side of the face, the cheek. So you can see this is the round lesion. This is the nose. So this round lesion is a basal cell carcinoma arising from the basal cells of the skin. So this is a basal cell carcinoma. Okay. So this is a basal cell carcinoma. So now, according to the some of the tumors, it will have two types of cells. Okay, it will not have only squamous cell or glands, but it will have two types of cells. So these are called as the mixed tumors, like salivary glands. Salivary glands, there is a mixed tumor which is called the pleomorphic adenoma. Okay, pleomorphic adenoma. So it will have more than one type of cell. So this is called as a mixed tumor. Similarly, renal, we have the Wilms tumor which have many more than one type of cell. So that is called as this one. And finally, we have the teratoma. Teratoma, it develops from from the germ cell. What is a germ cell? Germ cell, they are primitive cells. When the baby is developing in the mother's womb, there are germ cells which give rise to different tissue of the body. So these germ cells, the tumor arising from the germ cells, it is the teratoma. We will study afterwards, but you can remember the tumor arising from the germ cell, it is the teratoma, and we will see the teratoma afterwards. Okay, so here you can see this is a mixed tumor. Here you can see the salivary gland, where you will see not one type of cell. Now see here, squamous cell, you will see only one type of cell. Squamous cells are proliferating. No other type of cells are there, only squamous cell. But here you will see two types of cells. The epithelial cells also there and the fibrous cells also there. So this is the stroma. This is called as these are the dark blue cells are the epithelial cells, and the pink and this light color is the stroma. That is the fibroma cells. So there are two types of cells, and this is called as a mixed tumor. Now teratoma, you can see teratoma, I told you, it is a germ cell tumor. It arises from the germ cell. What is the germ cell? When the baby is developing, first the zygote is formed from the ovum and from the sperm. Then it will form, these two cells combine to form zygote, the sperm and the ovum, and then they will give rise to 4 cells. Then they will give rise to 8 cells, and these cells will multiply. So these are called as the germ cell. From these germ cells, all the tissues of the body, whether it is the heart, whether it is the lung, whether it is the brain, all these develop from these germ cells. Germ cells are primitive cells. Okay, they are the old cells. So when the tumor is developing from primitive cell, from the germ cell, this is called as the teratoma. It is also called as the dermoid cell. So what is the characteristic of this tumor? It will have many types of tissue, because the germ cell can produce any type of tissue. All the tissue of the body, like the lungs, the heart, the teeth, the bone, everything is produced from the germ cell. So this tumor will have many different structures. Here you can see it will have teeth, it will have hair. You can see this hair. It will have this sebaceous material, that is the fat. It will have fluid. So it will have many different types of tissues. It will have teeth. It will have hair. It will have epithelial tissue. It will have sebaceous glands. So many different types of tissue you will see in this because it is developed from the germ cell. So it is a teratoma. Now I told you from the histogenesis means from which tumors from where the tumors is originating. So I told you there are epithelial tumors arising from the epithelium. So it will arise from the stratified squamous epithelium, or from the basal cell, or from the glands, or from the renal epithelium, from the liver cells, or from the urinary tract, or from the placenta. So these are all the epithelial cells. Epithelial means the cells which are on the top. Like the skin on the top, there is the stratified squamous epithelium. So if the tumor is developing from the epithelium, it is the epithelial tumor. Okay, below the epithelial layer are the mesenchymal tissue. Okay, below mesenchymal will be like the muscle, the bone, the connective tissue, the blood. These are all the mesenchyme. Okay, these are mesenchyme. Epithelium means from the epithelium, the topmost surface, like the stratified epithelium or the glands, which are present, sweat glands, sebaceous glands. Okay, so these are the epithelial tumors. And mesenchymal will be from the deeper tissue, like the connective tissue, the muscle, the blood. So if it is arising from the connective tissue or from the fat, it is called as the fibroma. It is arising from the fat, it is called as the lipoma. If it is arising from the endothelium, from the blood vessel, it is called as the hemangioma. If it is arising from the blood cells, it is called as the leukemia. If it is arising from the muscle, the tumor arising from the muscle, it is called the smooth muscle or striated muscle. So it is called the leiomyoma or the rhabdomyoma. So these are the mesenchymal tumors arising from the deeper tissues. Then I told you tumor arising from the germ cell, from the primitive cell, which are the cells which are present in the fetus. In the fetus, when the fetus is developing, those are called as the germ cell. So when the tumor is developing from the germ cell, it is called as a germ cell tumor. And the most important is teratoma. You can see this teratoma. So always remember, teratoma is a germ cell tumor, and it will have many tissues in it. So the other germ cell tumors are seminoma, choriocarcinoma, and the yolk sac tumor. But the most important is teratoma. Teratoma is a germ cell tumor. And what are the tumors? And usually these germ cell tumors, because they are arising from the primitive cell, they will be present in babies, in newborn babies, because they are arising from the germ cell. So in infancy means from birth to 1 year. So from the birth to 1 year of the baby, the tumors which you will see, the tumors which are present in the newborn babies in the 1 year of birth, after 1 year, in the 1 year after birth, there is a nephroblastoma, neuroblastoma, medulloblastoma, retinoblastoma, hepatoblastoma, and embryonic sarcoma. So you should remember these are the embryonic tumors arising from the embryonic cells of the infancy. Then also there are some tumors, they arise from pre-existing malformation. Pre-existing malformation means some tissue, they have to disappear after the baby is totally matured and born. Some tissue have to disappear, but they do not disappear and they give rise to malignancy. So these are called as the pre-existing malformation. So what are those? Chordoma arising from the notochord, remnants of the notochord. Usually the notochord, it is in the sacrococcygeal region. This notochord disappears after birth, but when it remains, we can give rise to tumor which is called as the chordoma. Similarly, the odontogenic epithelium in the lower jaw, it disappears, but if it remains, it will give rise to this tumor, adamantiumoma or amyloblastoma. Similarly, craniopharyngioma, there is one Rathke's pouch in the skull area. If it remains, it will give rise to craniopharyngioma. Okay, and similarly, undescended testes, the testes, they have not descended to the scrotum. They remain in the abdomen. So if they remain in the abdomen, the testes remain in the abdomen, they can give rise to the testicular neoplasm, the testicular tumor. So all these are tumors from the pre-existing malformation. Now, according to the origin, so this is how we have differentiated the tumors. Okay, so all of you can see this is how we have differentiated the tumors, the nomenclature of the tumors. Okay, how we name a tumor. Okay, so how we name a tumor according to the organ of origin. Suppose the tumor is arising from the lung, it is called the lung carcinoma, lung tumor. If it is arising from the intestine, it is called the intestinal tumor. If it is arising from the liver, it is called the liver cancer. Okay, so according to the organ of origin. Secondly, how we name the tumor according to the cell of origin, from which cell is originating. Okay, from which cell it is originating. Suppose it is originating from the squamous cell, so we will say squamous cell carcinoma. If it is arising from the glands, it is called as the adenocarcinoma or adenoma. So according to the cell of origin, from which cell the tumor is coming. Okay, then from the type of the tumor, whether it is benign or malignant. I told you benign will end with name OMA, okay, and malignant will end with name carcinoma or sarcoma. So according to the type of the tumor, we will name like whether it is carcinoma or sarcoma, it will be malignant tumor, and if it ends with OMA, it is a benign tumor, lipoma, adenoma. Okay, then differentiation. Differentiation means how the tumors resemble the original tissue. Okay, if it is if it resembles, if it looks like the same original tissue, it is called as well differentiated. Okay, and poorly differentiated means it will not resemble original tissue, it will look somewhat different. So that is called as poorly differentiated. Benign tumors are well differentiated, malignant tumors are poorly differentiated. Then also there is grading. Grading means again it will be like from well differentiated to poorly differentiated. If it is well differentiated, the grade is low. Okay, if it is poorly differentiated, the grade is high. Then staging. Staging means how much the tumor has spread. If the tumor has not spread, it is stage 1. If the tumor has spread to the other tissues, to the other organs, it is stage 4. So according to the staging is according to the spread of the tumor. And metastasis, if the tumor has gone to the liver, it is called the liver plus. And if it is gone to the lung, it is called the lung plus, because these are the two important organs where the tumor will spread very fast. You know, if the tumor arises from the intestine, it will spread to the liver and the lung. Okay, so if it spreads to the liver, it will cause liver plus, and if it spreads to the lung, lung plus. Okay, so this is like when we see a tumor, how we name the tumor? First the organ. Which organ is the lung cancer? Okay, like this. Then which is the cell of origin? Squamous cell. It is arising from the squamous cell of the lung. Okay, then how it is in the microscopic? It is poorly differentiated or well differentiated? The cells are resembling or no? So it will be like poorly differentiated. It is high grade or low grade? It is high grade. Then it is stage 4 because it is spread to the liver. So it has spread to the liver, so it will be stage 4. So like this we have to do give the diagnosis. Okay, when we see under the microscope the tumor, we will give the surgeon this diagnosis. So accordingly then he will operate, he will do the operation. So this is how we have to do the we have to name the tumor. Then there are pseudotumors. Pseudotumors mean they are tumor-like condition but they are not tumors. They are just like tumor-like condition. They look like tumors but they are not tumors. Like Hamartoma. Like Hamartoma, you know, it is a tumor-like mass which is composed of normal tissues at the normal site, but it is not a tumor. Okay, it is just a mass of the tissue. It is not growing so it is just a mass. Okay, and Choriostoma, it is also a tumor-like mass, but from some other different tissue, like which is not present at that part, like pancreatic tissue. It may be found in the intestine and it will produce a mass. So this is called pancreatic tissue not present in the intestine, but sometimes the pancreatic tissue is present in the intestine and it will produce a mass, but it is not a tumor. So that is called as the Choriostoma. When the mass is produced by the same tissue which is present at that site, like suppose in the skin, like in vascular hamartoma, the blood vessel they are on the skin, the blood vessels are proliferating. So it is called as the hamartoma. So what is the difference between hamartoma and the tumor? Like teratoma is a tumor, right? Teratoma is a tumor and hamartoma is not a tumor. So hamartoma, it belongs to the site of origin. Okay, it belongs to the site of origin, whereas the teratoma, it is foreign to the site of origin. It is not from the site, it will developing from the germ cells. Okay, then growth is according to the surrounding. Okay, but the growth, it is a malignant tumor, so it will not be coordinated, it will grow very fast. Hamartoma is not a tumor, so it will not be, it is not growing, but this is growing very fast. It is uncoordination, no control. Okay, then it is not capsulated, and this is the benign teratoma is capsulated, and it is tumor-like, and this is a tumor. This is just looks like a tumor. So this is the lung hamartoma. You can see this is a tissue which is proliferating in the lung, and this is the lung hamartoma, and this is the teratoma, where you will see multiple tissues. I told you teratoma is a germ cell tumor, so it will have many different types of tissue. It will have cartilage. This is the cartilage. Okay, and this is the glands. You can see these are the glands. These are the epithelial lining. This is a fibrous tissue. This is the fibrous tissue. This is the epithelial cells. This is the cartilage cells. So all different types of cells you will see. So this is the teratoma, and this is the lung hamartoma. Now cyst. Sometimes the tumor produce cyst. They produce a cyst. What is a cyst? Cyst is hollow inside. There is a fluid inside. It has it is like a balloon. It is from the outside it is a mass, but inside it is hollow. It has fluid. So it is called as a cyst. What are cysts? They are cavities which are lined by epithelium, but inside the cavity there is a fluid. So accordingly, which fluid is there, whether it is serous fluid, mucinous fluid, sebaceous, then we can see which fluid it is there. Okay, if the cyst, then according to the number, if the cyst is 1, it is called as a solitary. If they are multiple, they are called as a multiple. Okay, if the cyst has many cavities, it is called as a if there is only one cavity inside, it is a unilocular. If there are multiple cavities, it is multilocular. Okay, and according to the origin, whether the cyst contains fetal tissue, or it contains retention tissue, or it contains hyperplastic tissue, according to the cells which it contains. So this is how we name the cyst cavities. Then structure, the neoplasm. If you observe the neoplasm under the microscope, you will have two types of tissue. Okay, first you have neoplastic cells, which are the tumor cells, and they will the area where the tumor cells are there, it is called as the parenchyma. Okay, and the area where there is no tumor cells, only fibrous tissue is there, connective tissue and blood vessels are there, that area is called as the stroma. Okay, so there are two areas of the tumor. If you observe under the microscope, the one area which have neoplastic cell, it is called as the parenchyma, and the other area which have connective tissue and the blood vessel, it is called the stroma. So what happens whenever there is a malignant tumor? It is growing very fast. The cells are multiplying very fast. Okay, so if the cells are multiplying very fast, there will be more parenchyma. The neoplastic area will be more. So there will be more parenchyma, and there will be less stroma. Okay, and more necrosis, because the cells are growing and the cells are not receiving enough blood supply, because the blood vessels are in the stroma. So if the cells are not receiving the tumor cells are not receiving blood supply, they will undergo necrosis. So malignant tumor has more necrosis because it is growing very fast. The malignant cells are growing very fast, and they will not be able, they are not getting enough blood supply, so they will undergo necrosis. So necrosis is a feature of malignant tumor. Now this is very important. Okay, this is very important, and many times in your exam they are asked the difference between benign and malignant tumor. Okay, what is the difference between benign and malignant tumor? So you should understand the most important difference is benign tumors, they are less dangerous. Okay, and the malignant tumors, they are more dangerous. Okay, because they grow very fast, they are large in size, and they grow very fast, and they will spread to the organs, other organs also. Whereas the benign tumors, they are very small in size, they are growing very slowly, and they will not spread to the other organs. Okay, so what is the differences between benign and malignant tumors? Okay, so what is the difference? First, well circumcised. What do you mean by well circumcised? Well circumscribed means it is round in shape. Okay, it is round in shape. Okay, it is not irregular in shape, it is round in shape. It is round in shape, whereas malignant tumor, it is not well circumcised. It is not round in shape, it is irregular in shape. Okay, it is very irregular in shape. If you see here, I will show you this. I have shown. See, this is a benign tumor. You can see it is round shape. You can see properly round shape. Okay. Okay, this is a benign tumor, very round shape. Whereas this is a malignant tumor. You can see it is not round shape, it is irregular shape, not well circumcised. So this is the difference between benign and malignant tumors, that it is well circumscribed, it is round in shape, and this is not well circumscribed. Then the benign tumors are usually small in size. They are very small in size, and the malignant tumors, they are larger in size. Okay, they are large. Then benign tumors, they are slow growing. They grow very slowly. Whereas the malignant tumors, they grow very fast. Okay, they are growing very fast. Okay, then benign tumors, they have a capsule. Capsule is a connective tissue covering around the tumor. So they have a capsule. It is capsulated. Because of the capsule, it will not spread to the surrounding organ, and it will not go to the other organs also. Okay, because it has a capsule. Capsule is it is a covering over the fibrous covering over the capsule. So this is capsulated, and this is non-capsulated. It doesn't have the capsule. Because it doesn't have a capsule, it will infiltrate. It will infiltrate the surrounding structures also, and it will go to the different organs also. The liver, lung. It will go to liver, lungs also. So this had a capsule, and this doesn't have a capsule. The malignant tumor does not have the capsule. The malignant tumor will be invasive and infiltrative. What do you mean by invasive and infiltrative? It will spread to the other organs. It will spread to the surrounding organs. You know, whichever organ in the surrounding, the tumor will spread to the surrounding organ. That is called as the invasiveness and infiltration. Whereas the benign tumor, it will not be, it is non-invasive. It will not spread to the surrounding tissue. Okay, it will remain in that area. It will not invade the surrounding tissue. Whereas this malignant tumor, it will invade and infiltrate the surrounding tissue. Okay. Then, because the malignant tumors are growing very fast, what will happen? They are growing very fast, so the malignant cell will not receive enough blood supply, and they will undergo necrosis and hemorrhage. So hemorrhage, this is hemorrhage. Okay, so hemorrhage and necrosis will be seen in malignant tumors, whereas no hemorrhage and necrosis will be in benign tumors. So in benign tumors, there will be no hemorrhage and no necrosis. Okay, whereas the malignant tumors, there will be hemorrhage and necrosis. Then what do we mean by metastasis? Metastasis means the tumor spreads to the not only surrounding organs, but it will go to the distant organ also, the organs which are far. Okay, like liver and the lung, it will go through the blood vessels or through the lymphatic vessel, through the blood. The tumor will spread to the distant organ, to the organs which are far, like the liver and the lung. That is called the metastasis. So the malignant tumor will undergo metastasis. It will spread through the blood to the different organ, like the lungs, the liver. Okay, whereas this benign tumor, it will not metastasize. It will not spread through the blood, and it will not go to the different organ metastasize. So it will not metastasize. Then if you see benign tumor, if under the microscope, it will be well differentiated. Well differentiated means it will resemble the original tissue. It will resemble like the original tissue. But here, the malignant tumor, it will not resemble the original tissue. It will resemble something different. Some irregular cells you will see. You will not be able to identify which it is originated from the original cell. So it is poorly differentiated, and this will be well differentiated. And as I told you, the suffix OMA, it is for the benign tumor like fibroma. We use the suffix OMA. So if you OMA is in the ending, it is a benign tumor like fibroma. But if the ending is with a carcinoma or sarcoma, it is a malignant tumor. Okay. So this is the differences. So here you can see the differences. If you see, this is a uterus. Okay, this is a uterus, and this is a fallopian tube. And see, this is a malignant tumor, and this is a benign tumor. So malignant tumor, I told you, it is well circumscribed. Well circumscribed means it is round in shape. Okay, and this is irregular in shape. The malignant tumor is irregular in shape. Okay, then it has a capsule. You can see this yellow color, that it has a capsule, whereas this doesn't have a capsule. Okay, then here you can see the tumor is not invasive, or it is invading or infiltrating the surrounding tissue. It is remaining here only, but here it is spreading into the surrounding tissue. You can see this malignant tumor is spreading to the surrounding tissue. Okay, so this is spreading to the surrounding tissue. Finally, if you see here, it is slow growing, so it is a small in size. Where it is fast growing, it is larger in size. Okay, and it is fast growing, so it is larger in size, and this is small in size. If you take the microscopy from here, you can see this, it is arising from a muscle. So the tumor cell will resemble like a muscle cell. You can see the small muscle cell with a spindle shaped cell. You can see the spindle shaped cell, the spindle long cells with a nucleus. So these are spindle shaped small muscle cell. So it will resemble the original tissue. So it is a benign tumor. Whereas here you can see the cells are not resembling the muscle cells. They are looking somewhat different. They are looking somewhat irregular in shape, and they are not resembling the muscle cell like spindle shaped cells. Okay, so this is poorly differentiated, and this is what we say, this is well differentiated, and this is poorly differentiated. Finally, what will happen? It will not, this is a vein, it will not invade the blood vessel, and it will go to the different organ. Whereas here you can see the tumor, that is, this is a tumor. You can see the tumor is invading the vein, and it will go into the blood to the different organs, liver and the lung, and that is called as a metastasis. Okay, so this is the important differences between the benign and the malignant tumors. All of you are understanding or no? Are you understanding?
Yes, clear.
Okay, let me take the attendance first. Okay, then I will continue. 1 minute. We have already almost finished it, but we will just revise. Okay, so all of you have understood this one. So this is very important. This is a very important topic. Okay. So you can see this is the difference you should remember. Okay, all of you understood the difference between benign and malignant tumor. So what is a tumor? What is a tumor? Okay, the tumor is, tumor is a new growth which is uncontrollable growth. That is called as a tumor. Uncontrollable growth is called as a tumor, and the mass which is produced is called the neoplasm. And the swelling which is produced by the mass is called as a tumor, and the study of tumor is called as oncology. The benign tumors have ending OMA, and the malignant tumors have carcinoma or sarcoma. So these are malignant tumor. Like if it arises from the glands, adenoma. If finger-like projection, papilloma, and if arises a mass, like called as a polyp. Okay, and according to the tissue of origin, if arises from the fibrous tissue, fibroma or fibrosarcoma. So this is a malignant tumor. You can see arising from the bone, osteosarcoma. This is a benign tumor arising from the smooth muscle. That is the leiomyoma. Then from the cell of origin, if it is arising from the squamous cell, it is the squamous cell carcinoma. If it is arising from the glands, it is adenoma or adenocarcinoma. So this is how you have to identify the tumors. Okay. Then according to the cell of origin, whether it is epithelium, stratumate, squamous epithelium, or from the mesenchymal blood vessel, hemangioma. And from the tumors, if derived from the germ cells, it is a teratoma. Okay. So this is how you have to differentiate. But the most important, you should remember this differences between benign and malignant tumor. Okay, this is very important. It is well circumcised. This is not well circumcised. It is small in size. It is large in size. It is slow growing. It is fast growing. It is capsulated. It doesn't have a capsule. It will invade the surrounding tissue. This will not invade the surrounding tissue. It will have hemorrhage and necrosis. This will not have hemorrhage and necrosis. This will go to the different metastasis to the different organs. This will not metastasize. Benign will not metastasize to the different organ. This will be well differentiated. This will be poorly differentiated, and it will end with OMA, and this will end with carcinoma or sarcoma, melanoma. So benign tumors, you can see it is small in size. It is slow growing. It has a capsule. Okay, it has a capsule, and it will not spread to the surrounding tissue. It will not go into the blood to the liver and the lung. It will not metastasize. So the benign tumor will be small, well demarcated, has a capsule, slow growing, non-invasive, not invading, not going through the blood, not metastasizing, and it will be well differentiated, that it resembles the original tissue. Whereas the malignant tumor, it will be large in size, irregular in shape. Okay, it will be spreading to the surrounding tissue. It will be going into the blood to the different organs, liver, and metastasizing, and it will be poorly differentiated. It will not resemble the original tissue. So this is the difference between benign and malignant tumor. I hope all of you have understood. Okay, so if